Welcome to the SAFE Coalition, Confronting Our Crisis. I'm Dr. Ann Bergen, and I'm going to be helping to moderate a series of programs on this very real crisis of substance use disorder. By now, there aren't too many of us out there who aren't aware of this crisis, which has plagued certainly not only Franklin and surrounding communities, but virtually every community across this entire nation, impacting people from all ages, from teens, and now we know increasingly senior citizens are equally impacted by this devastating disease. And certainly it goes across all socioeconomic levels. But the only problem over time sometimes is we get used to hearing these stories, and sometimes people start to become statistics. We get a little bit numb, maybe some indifference settles in, maybe a belief that we really can't do too much, and this tendency to give up. But this series of programs was created so that we do not forget the people behind the disease, and we don't for a second believe that there's nothing more to be done, and there's not a lot of us to do together as a community. We can't look away from the tragic loss of life and the torment and anguish of those living with the disease, and ultimately that all of us, all of society, is impacted by the consequences of this disease. So with that, I'd like to introduce Jim Derrick, who is the creator and producer of this series of programs, who along with other members of this coalition is working tirelessly to keep our eyes on the souls of those who are in the grips of this disease, and that together he wants to make sure that we can all make a difference. So I want to welcome you, Jim, to start off, and thank you for the honor of allowing me to be a little bit a part of this program. So I was going to ask if you wouldn't mind introducing all of the guests here today, and then maybe just remind people what the mission of the coalition is.
Be happy to,
Okay.
and thank you, Ann, and thank you to Franklin TV and everybody who has made this program possible. So why don't we start out with our guests? I'll start over here with Jennifer Knight. Jennifer is the vice chair of the SAFE Coalition. Town Councilor Robert DeLorco. He is a town council member here in Franklin and is also on our board of directors. State Representative Jeffrey Roy, who is a founding member of the coalition along with Jennifer Knight, and you'll hear about that later on. Jeffrey is on our board as well. Steve Spiewakowski, who is a probation officer with the Rentham Courts and serves on our board, and Chief T.J. Lynch, who is the Chief of Police with the Franklin Police Department and serves on our advisory council.
Good. And just so people understand the acronym SAFE.
Sure. So SAFE, the acronym stands for Support for Addicts and Families Through Empowerment. And in particular, what we are trying to do is provide education and prevention, supportive services, and treatment options for people that find themselves with substance use disorder.
Excellent, good. But I think it's kind of fascinating how the whole coalition began, and I think it's fascinating because of the stories behind it. I think that always helps to bring the issue out in front when we hear those stories. So I was wondering if we could start just briefly, because some people have heard how this all began, but I think just the story behind it and the impetus to get it going, and I think maybe, Jen, you can start off and tell us a little bit about that.
Yes. Absolutely. So the SAFE Coalition kind of started with Jeff Roy and I. I moved back from California, and I was noticing that there were more and more folks that were either going on to the addiction side of things or were actually passing away. And so coming from a mental health background, I really wanted to do something within the community that I was raised in to really help families and friends of those who were addicted. And so I went to Jeff Roy and kind of said, hey, do you have any advice? Do you think we could do this? And from there, we started working together and got a group of people around the table that had some really great ideas as to how to enter into the community. And then we had a town hall meeting, which we first thought might have 10 people at it, and it had over 100. And we had a panel discussion, and it was one of the most incredible nights of my life. And from that, we met some great people in the audience, and some great people asked some questions, and some of those people are sitting here today. And so from there, more people came to the table, and this is what we have now.
And you knew some of those young people. Particularly, it was not that it isn't just the young people who are impacted by, but you knew some, and I know like a lot of them were my former students, and all of a sudden we're seeing these young people, and at 25 and 26 and in 40, and so going from there. And then Jim, will you tell us about how you got pulled in too?
Sure.
Because your story is really
Sure. Well, I was one of those people in the audience, and my son had been struggling with substance use disorder for years. And I was sharing a story with a friend the other night that 10 years ago and even recently, we just didn't talk about these things. And so I was very much to myself about it. I just told people he'd gotten off a track. When in reality we were fighting the battle of our lives, and he had a car accident in March and was in a coma, emerged from that coma and went off to treatment. And one evening I was driving down Route 140 and saw the sign flashing announcing this meeting. So I stopped my car, backed up. I couldn't believe we were going to have this discussion out loud in town. And that's when I came upon the panel discussion. So I was an audience member. I listened to Jennifer. I listened to Bob DeLorco, who I knew was a town councilor. I didn't know him personally. I didn't know Jeff Roy personally, but I listened to them and TJ's predecessor, Chief Submergent, and other public officials that, I've been here for 29 years, but I'd never seen such compassion and emotion coming out from the stage, and real understanding, a real searching for a communal response to this. I believe there were 5 overdose deaths the month that you decided to push the boat off.
and you heard this and just jumped on board because you were such a force in hearing Jen and collaborating in Jim's story. And
I can remember getting the email from Jen, and it was probably about 6 or 7 months before we had that forum, and it was an idea, and the question in my mind at that point was, how do we engage a community in a conversation of this magnitude? And as a representative of the community, am I doing a disservice by suggesting that there is an issue with drugs in the community? Are people going to be upset that this topic is coming up? And I think those were our initial conversations. And it was in May of 2015 that we lost 5 people between the ages of 20 and 40. And I distinctly remember getting a call from Councilor DeLorco saying, we can't keep quiet about this anymore. We have to get public with this, and the decision was made. Yes. Let's go to the town council. Let's do a presentation. Let's engage in a very high-level conversation. The District Attorney Morrissey came to that meeting, and I think everything began to evolve. And that June 30th meeting, I said, was very impactful for me. And I recall, I think there was something close to 300 people at that meeting.
There were so many people.
Right, to go there, and right, the stories that were coming, and the people who came up to the microphone to share their stories. Father Manning coming up to the microphone talking about burying 18 people since January of that year. Very impactful, and to me, to see the community embrace this topic and talk about it openly, it certainly opened my eyes, and that's I met Jim that night. He came up on the stage afterwards and shared his story, and over the next 6 months emerged as the leader of this organization.
And I remember that night being there, just part of it, and witnessing it. It was like for the first time, like the stigma was beginning to lift because people had the courage to come forward in front of everybody and share their stories, and you can feel the palpable, the pain and agony, right, of the, but it just, to me, marveled again how the community all came together. But and what you said, Jeff, it is really the focus of the next question, because it was a point where you said, we can't be afraid to face this head on. We can't pretend it doesn't exist. We have to get it out in the open. And with that in mind, I wanted us just to see where we are now, to see we're certainly making strides, but just to kind of get it out there as bluntly as possible is how big is the problem? What are we still seeing out there? what is it that the community still needs to know, that there still is an issue? And just to sort of maybe if we could talk about that as the next part of this, now once we've seen how it all got started. I was wondering, maybe Chief, you could start us off on that one.
I mean, it is still a major
Yeah.
problem. Just as you said before, it is national, but we're not immune here in Franklin.
Yeah.
And unfortunately, since January 1st of this year, we have had 35 overdoses. And even more unfortunate is the 7 individuals that passed away from it.
This is just
Did not
since
make-
January?
Since January 1st of this year.
In
In
Franklin.
2016 in Franklin, correct. So it's still an issue.
To kind of staple that home, the statistics in Norfolk County are just as alarming. In Norfolk County 5 years ago, we had roughly 600 fatalities, opioid-related fatalities. This year, unfortunately, we're headed to 1,700 fatalities.
Wow.
So it is a county-wide, statewide, and nationwide public health epidemic.
Can I put a bright side on that statistic? You talked about 35 overdoses.
Correct.
And we did have 7 deaths. That tells me that 28 people were saved through that process. And I know part of the work has been done is the administration of Narcan and having it readily available. And that's what I'm hearing. I hope that's what I'm hearing from
Yes.
you, Chief, that people were saved.
There are a number of people that have been saved, through the administration of Narcan, whether it be the police officers who, maybe arrived before the firefighter personnel with the rescue, from Franklin Fire, and also they've had it, and they've had it for a long period of time. But a lot of times we end up getting there first. The Norfolk County District Attorney ended up putting a program together in which we originally joined in on, got some training, some instructor training, and then and trained all of our officers. So all of the cruisers, when they're out in the street, they have the Narcan available, and they use it regularly. So it has definitely assisted, in that process of being able to save people.
Jen, do you see in your practice and stuff, are you still young people, not just young people, because again, that's sort of the misconception that it is just
Yeah.
young people. It is not. And again, when we had that forum with at the senior center, we know that is. I'm just curious to see, are you seeing through the people coming to you that we're still in the grips of it, or what can you speak to about?
Absolutely. I think that we are definitely still in the grips of it, and I think that parents are becoming more aware and are coming out earlier to ask questions about what they can do ahead of time.
Yeah.
And that, I think, is incredible, because what we really want to do is create a container for people to come and feel like they have a voice and we can answer compassionately the questions that they have. And so what I'm seeing a lot more of versus last year in the support groups or in home visits are that families are willing to open up and say, I think my child might have a problem, but I don't think they're using heroin. How can you help me move through this? And so I think that is incredible, because people are asking for help earlier on.
Right.
It's also alarming how many people are asking for help.
Right, and that's the part. Yeah, go ahead, Jen.
It's okay. I was
Yeah.
gonna thank you for that. I was gonna ask Councilor DeLorco, Bob, what is the impact that the town feels from the councilor's perspective of having this almost unmitigated heroin and opioid and substance use disorder epidemic in town, and how do you think the public conversations and the public dialogue that has gone on has helped or changed the landscape?
Well, I definitely think that we definitely brought a light to the issue with what we, like I said, when I called Jeff that time and said, we definitely have to do something. And of course, I have a great relationship with all the police officers. Being a youth coach and high school coach, you see a lot of your kids pass away, but I think we definitely are in an issue that obviously we're not as bad as I would say other cities and towns. I mean, my friends in Boston tell me that it's running rampant in Boston. So in Brockton and Taunton and that area down there, it's just crazy down there. They said that's they're running through Narcan left and right. I think the Narcan training was something that we got together to make sure that went through. I mean, it's something that we're going to have to deal with. I mean, it's not going to go away anytime soon.
You know, one thing on that, on his point,
Yes.
and addresses your question. When we started and we got involved in this, Franklin was a community that did not have resources.
Yeah.
It did not. People had a lot of questions, but they didn't know who to turn to or where to go. And you know, through the work of the coalition, they have a Learn to Cope chapter in Franklin. Jen has her Thursday night support group meetings. There's another support group in Milford on Wednesday nights. Now people have a place to go and get their questions addressed and answers. And I think that has encouraged the conversations. And from what I've heard from folks that I spoke to on the council, they're delighted that these things are available and that they're part of a community that can have this type of a conversation.
Jeff, I think that's such a powerful point that you made, and in future episodes we will be highlighting many of the support groups that Jeff just spoke about. And anybody that needs information can go to our website, which is safecoalitionma.com, and information links will be to the support groups. But I think, you know, somebody asked me what's the importance of a coalition, and the idea is to break the silos down. We used to walk around and sort of, the police had their silo, fire had their silo, clergy had their silo, and there wasn't a lot of conversation, certainly not about this issue, and citizens like myself. And my comment to somebody was that I am confident that in this town right now, anybody with a problem could walk into a church, to their state representative's office, to a town councilor, stop at a police officer on the street, or see Steve, who we'll talk to in a moment about this, at the courts, and ask for help, and they're going to get help. And that's a monumental shift as a parent of somebody who suffers from this, from where we were before this atmosphere existed.
One of the things that I wanted to mention, too, before we sort of get off this topic is that up until this point, the scope of the problem for a lot of the towns in Massachusetts has been the number of overdose deaths. There are some areas in Massachusetts that have more deaths than others. I was at a training this afternoon, a substance abuse certification training, and there were probation officers there from all over the state, from the Springfield area, from out in Greenfield, from southeastern Mass, from Quincy, and all of those areas have significant problems just like we do. But like I said, we have been measuring the scope of the problem with the number of deaths, and with the introduction of Narcan, you can't rely on that statistic alone anymore. The chief was just saying how many Narcan revivals we've had in Franklin alone, and we have to take that into consideration, especially when we're talking about funding for police departments and personnel.
Absolutely right.
And first responders. How many saves are there? How many lives are being saved so that they can be alive another day to hopefully pursue treatment options?
Yeah, and you know, that's what a great point, Steve. District Attorney Morrissey and his office, Jennifer Rowe, they have been tremendously supportive of coalitions in general. But their data input and entry is so well done, and they're tracking exactly that. And I'm going to say that the last number that I received was around 11,000 reversals in Norfolk County, and I'm not sure what period that was, but say it was back in August roughly, so that was about an eight-month period. So your point's really well taken. Steve, you're a probation officer, and you work in the Rentham court system. Can you give us kind of a sense of the landscape from your viewpoint?
Sure. I've been in Rentham court for about 18 years, and over the last 3 or 4 years, this issue has ballooned in my court, and that's what sort of prodded me in this direction to become involved with the coalition, because I was seeing people come into the court and into my office that reminded me of my own kids. And the old perception of people suffering from substance abuse disorders being in back alleys and on the streets and homeless, that's not the model anymore. A lot of the people that are coming into the court and into my office are from good families. They have good support systems. They're athletes. They're former cheerleaders. They're people who are college students who have jobs, or people who are well-to-do. and got introduced to the opiates through, a painkiller from a dentist, or had a sports injury and were on a long-term course of pain medication. So when I started to see those, and I hate to use this word because nobody really is, but normal people, normal everyday people like you and I, come in and then hear names down the road of those being people that passed away because of an overdose, it really had a large impact on me, and I felt like I had no choice but to do something more than what we were doing within the context of the court. And I found the coalition to be very beneficial to the court in the way that it has shined a light on what the stigma has been. It has come a long way within just my building on reducing the stigma and how people perceive the issue as being a disease and an issue that people need assistance with, and an issue that you can't just put people in jail and just expect the problem to go away. People are dying because of this issue, and the people in my building, because of the formation of this coalition, are more sensitive to that now.
But,
yeah.
excuse, I just want to point to that is the stigma, like when I remember as young, the drug addicts were just, like you said, the people in the alleys. But a quick story about one of my friends, and Jen's helped me with this, and Jim, you have too, and Jeff and Steve, they all have. But I've gone over this guy's house probably twice a week for forever, for like a couple of years, a good friend of mine. He sat me down one day, and he told me that his daughter was a drug addict, and his daughter lives with him, so I've seen her all the time. He said, and I've spent probably $60,000 in the last 3 years, and I can't do it anymore. I would have never known it, Ann. I mean, she just didn't look like it. I mean, we've since got her help, and we've got her down the floor and everything like that. But that's somebody that I've gone over that house maybe twice a week. Had no clue.
Yeah.
That's a powerful story.
Yeah.
I was just going to ask about that kind of the head in the sand type of thing, is just as an educator and someone who really wants to focus on prevention. I think we have to be really realistic that this young kids are also doing the gateway kinds of things. Alcoholism, right? I mean, alcohol, not alcoholism, but you listen to kids like Derek Getchell, not kids, and you talk when they started, and a lot of them was starting at very young ages, when they were middle school, when they were 12 and 13. I was just wondering, from the perspective of the courts and the police, if do you see an issue with this younger kids starting and stories about things that might be happening not in the high school, but at the high school level? Because I think we have to really kind of, as educators, say, we also have to be really blunt about looking at the problem and saying, we've got young kids who are, or do we? I mean, is that something that I'd like to get just from someone who's really focused on the whole prevention thing?
I mean, I think alcohol is a gateway.
Right.
Marijuana
Yeah.
is another gateway drug, and these things are happening.
Yeah.
But it's not to the point that we're having we're not running into it all the time.
Got it.
House parties are almost non-existent.
That's a good thing. I was going to ask you about that. So,
No, I mean,
yeah.
we did a lot of, through grants that we received
Yeah.
from the Highway Safety Division of the Executive Office of Public Safety over the years. We in Franklin have done a number of alcohol-related programs, such as shoulder taps to prevent people from buying for younger people. We do a lot of. We've also done a lot of different types of programs where people go in and try to buy alcohol from package stores and so forth, compliance checks. And because of those programs and party patrols that we've done over all these years, I think a lot in the community know we're out there, we're looking for it. But the house parties we're not seeing as often.
That's great.
If they're out somewhere else doing it, we're not aware of it because we're just not getting the calls. We're looking for it, we just don't seem to find it. And we're not. And you have your problems at the high school off and on, but
Yeah.
it's not endemic. It's not but what you find out is as Steve had mentioned, sports injuries, individuals on workman's comp. Those are the people who unfortunately got prescribed an opioid for the pain, and after a while, unfortunately, get addicted to it. And once that occurs, a lot of times people don't use all of it, and so you keep it in your medicine cabinet or whatever, and that's where the kids are usually where they start with. So once they get hooked, they start looking for grandma and grandpa's medication that they might have had, or somebody else in the family. And what happens is that avenue runs out. And then they start to try to buy it on the black market. Well, it's expensive. It's about $1 a milligram. So if you were used to doing 40 milligram pills, now it's $40. And then eventually what it leads to is to go into heroin, which is another opioid that on the black market is very cheap. And that's how the progression usually starts to where they end up
Can you
getting
add, just
it.
out of curiosity, the source of the heroin? Are you seeing that decreasing in terms of being accessible to people in this area?
Well, here in Massachusetts with 95, 495, I mean,
Yeah.
we're in an area that is saturated.
Okay, so that
with heroin. It's
and
one of the
that's-
reasons that we don't
yeah.
have a major problem with methamphetamine, which is very popular throughout the western part of the country, down south, is because heroin is so available here. That is the drug that they normally, if people go to it or have an addictive personality and get involved in
Exactly.
narcotics, that they go to heroin because there's not a lot of methamphetamine here.
Are you seeing that hasn't decreased? That, I guess, is my question. In other words, it's still easily accessible.
Oh, it is very easily
okay, at that end of it.
And inexpensive as a result of the supply, right?
Inexpensive.
Yeah,
Yeah, it is.
inexpensive, yeah.
It's very, it's inexpensive to get. They have no problem giving it away to get people to, continue to be hooked on it, and so forth. And I think the coalition's doing a fantastic job. I mean, we in the police department, support it because we've been involved in this forever. I mean, as far as the issue of the conversations and how everybody said that they didn't want, might not want to talk about it out in the open in the Senate, but we've been battling narcotics and trying to keep narcotics off the streets and so forth since forever. So we've been dealing with it, and my narcotics detectives for years have tried the best they could with limited resources to help people to get the resources that they may need, the treatment and so forth. And sometimes it becomes overwhelming. So SAFE is providing those a quick avenue, a quick place to get assistance and to get them the people the help that we need, because that's all we want to do, because we're the first responders. My people are showing up, the police department, the fire department, we're going there all the time, we're seeing this firsthand, and so we're every day or every other day, we seem to have something go on and we're involved in it, and so on.
Just to follow that up, Chief, I have to, having personally been involved with your officers in your department now for the better part of a year in my role with the Safe Coalition, I couldn't be more proud of the town of Franklin and your staff. I'm always interested in the idea of community policing and the idea of seeking to serve and protect, and the service part comes in attempting to get people help. Can you talk a little bit about how that's evolved, or have you always been doing it, or have you increased your efforts to get people help when they have a substance use disorder?
No, I mean, like I said, I have two officers, two detectives that entirely all they do is narcotics. A majority or 90% of what they do is narcotics work. We also have an individual now connected to a federal task force in which a majority of what they do is narcotics work, but they can move in and out of the town, the state for that matter, if need be, to look for the dealers that are dealing with this. But that's not where it stops, where we make an arrest or make a case on a dealer. You have individuals that that need the help, and we want them to basically, if we can, assist them in kicking the habit so that they're not involved in it, because the chance, and now of course there's an increased chance of death, whereas before there wasn't. With the fentanyl being introduced into the stream of things, into the system, and now there's even a more potent fentanyl, which is a elephant tranquilizer, essentially, that now they're starting to cut with that. So which is 100 times more powerful than fentanyl. So our people do not want to see people dying from this. They want to see them get the help. But like I said, there's only so much we can do, and there's only, they're busy. We have this, and community policing has always been a big part of that. So they're welcoming the fact that now there's more people that want to assist and be involved, and that the resources are going to be out there. And I'm not going to steal Steve's thunder with all the work that he's done on what we're going to be, doing in the near future to give people the information they need, especially those people that might have as you had said, a younger person that you had no idea about. But when did the parents finally figure it out? When they finally learn, wow, my son, my daughter, my brother, my sister has an addiction. What do I do? And I think, now they're going to be able to find out ahead of time, and if unfortunately there's an issue where it's the first time they find out it's an overdose, we're now going to be able to give them some material to use. So yeah, we're big on community policing. We're not going to arrest our way out of it. You've heard it before from others.
Right.
You've heard it from law enforcement
That's
professionals
huge.
across the country. It's not going to happen.
And when I sat in that auditorium last year, I was again. This is just an anecdotal. I was happened to be sitting next to somebody who was upset with the police. They felt that the police, frankly, they were just angry. Their loved one was sick, and the police hadn't done enough. Okay, and having now a view into the police station, I can tell you that probably wasn't the case. I do understand that emotion. Being a parent myself, you want a lifeline. And hopefully that's what a coalition can provide, or more lifelines dangling down so that you have more to grab onto. But Steve, I'm curious as to you're a very compassionate guy when you're dealing with your detainees.
I try to be.
Detainees?
Probationers.
Probationers. Okay, I never know what to call them. But having known you now for some time. I've seen the way you work, and I've also seen you at work. You're a different person at work than you are here, out of
Hopefully
necessity.
in a good way.
Are the courts generally taking the same approach as police agencies? I'm speaking more globally now, not just in Rentham.
Globally, I think we are, and just to touch on the whole gateway so that we can sort of follow this path through. One of the jobs that we do as probation officers is that we sit people down in front of us and we interview them about their history. And I can tell you that the gateway stuff that was there when we were all kids is still there. I think that the law enforcement and social host liability laws have done a great job on reducing sort of those big, huge parties. I used to come into work, 6, 7, 8 years ago, and there would be 30 or 40 kids from Franklin in the lobby, and all charged with minor in possession of alcohol. And other towns. And other towns. Thank you for clarifying that.
But this is going out to me.
You needed that one, Jeff.
I know it was going on in every town, and it was going on when we were kids.
Yeah.
But I think law enforcement has done a great job on sort of keeping tabs on those. There's been legislation passed that makes it, punishing to families who allow that kind of thing to happen. So those incidents, I feel, have gone down anecdotally. We don't see those much at all in the court anymore. But in talking to people individually, you talk to people and they tell you, I tried marijuana for the first time when I was 12. I tried alcohol 2 years after I tried marijuana because marijuana was easier to get. People grow it in their homes. You pick up a phone. You don't have to go into Boston or Quincy anymore to buy it, or Woonsocket. You pick up the phone and you make a call, and it comes to your house. So the gateway stuff is still there, and when you add, the sports injury stuff in, and you have these little, sort of groups around town or around any town that are sort of dabbling, and it kind of spreads. I think it seems to spread in small groups, and so the issue is there. The gateway issue is still there.
And we will have episodes that deal specifically on the neurobiology of addiction. So we're going to address this right up front. Having said that, I'm not an expert. I'll just share the fact that 1 in 6 people in general that try a substance, and I'm not going to be age specific, are going to become addicted to substance like opioids. So it is a bit of Russian roulette. The age at which somebody starts experimenting, as that comes down, their relative risk for developing substance use disorder goes up. Is that what you generally see, Jen? In your practice?
Absolutely. I think that, I think when I work with families, there are some families that say that my child has been smoking marijuana when they were 14 and 15 and 16, and I did that, and I'm fine. So where's the disconnect?
Good one.
And then I also have families that come in and say, my child was a senior in high school, they hurt their shoulder, then they got a prescription the next year for their wisdom teeth, and things just started to disconnect a bit. They still graduated from college, but now after college, we're seeing things kind of break down. So it's, I wish that I could say it was in this group or this age range or this historical story of someone's life, which kind of places them in an area where they might have more of a chance to be addicted to some kind of medication or substance. And I just don't see that. And I think that's one of the things that for SAFE we really want to target, that it's not a specific group of people or an age range or a substance, that addiction can happen really at any age. But truly what I see is that for children who start younger, preteen, early teen years, if they are drinking or smoking marijuana, by the time they are 18, 19, 20, and may or may not be addicted to opioids, it's just really hard for their brain and body to get back to that place because they've used substances for so many years. And so what I do see is that it takes about 5 years for folks to fully recover from any kind of opioid use. And add other substances onto that, it is really difficult.
And you know what, Jen, when you talk about those areas, what it illustrates, I hope for a lot of people, is that if you can educate children about cigarettes at an early age, we're starting with cigarette education, I think around 5 or 6 in the schools. If you can talk to them about alcohol, the dangers of alcohol at an early age, to me, this seems like a much more important discussion, and I don't think that it can start too early with children. I think you have to have these discussions early on with kids, and I hope one of the things that comes out of the SAFE Coalition and these forums that we're doing today is that, to let parents know, listen, educate yourselves first. Any way you can. Go on the internet, talk to people like us, and encourage your schools to provide this kind of education as well. And I mean, we'll do what we can to help, but when you're talking about an issue that's killing people every day, and every one of us in these chairs today has known somebody that has succumbed to this disease, and we're not talking like old age, we're talking kids between the ages of maybe 17 and 25 that we've all known. And so they don't just pick up their first drug when they're 17 years old. So those discussions need to happen much earlier than they're happening right now.
And there are certain best practices that parents can implement in order to make their home safer, and one of those is to turn in their unused medication. And I would include opioids, gabapentin, all of the types of things, anything that says it might make you drowsy, that type of thing. Chief, when can people turn in their unused medication at
We
the
never
station?
close.
You never close.
We're open 24/7, 365. So come right into the lobby. The kiosk is right there. They can just walk right in, and they just open it up and dispense the medication. And we'll take anything. I mean, if it doesn't have to be, opioid related or whatever, if they want to get rid of it and just get it out of the house, because we take it and we have it incinerated at a professional place that takes care of that. So, I mean, it's not a problem. And we've done tons, and I mean by weight, tons of narcotics and other medical supplies that people have brought down and gotten rid of.
I saw a statistic that roughly 75% of the prescription painkillers that are being consumed come from either a parent, grandparent's medicine chest or from a friend who has taken it from and sold it to somebody from the medicine chest. So it's not the dealer on the street corner that's providing these painkillers. It's coming from us, the consumers, who have been overprescribed for a long time.
And one of the shows that we're going to be focusing on in the future, because you raised a really good point too, is it's the education piece, but the part of that is that those young people or who are older people who use medication to self-medicate, who use because they're dealing with loneliness or sadness, that you can't educate them out of. You have to teach them to recognize their emotions. It's a huge thing that we need to start doing, and that will be for future, but I wanted to follow up, and I think the research you're doing is why people are starting, and getting that data is so important for us in education to say we need that data. That's why working together is so important. And you started to say something, and I interrupted.
I agree with Steve on the early education, but I also believe, I've been talking to a lot of kids that, including my own kids, but their education stops on drug awareness in 10th grade. And then all of a sudden they have nothing for 11th and 12th grade. And then all of a sudden they go to college. And that according to my kids and everybody I talk to, that's a whole new ball game.
That'll be it, yeah.
Yeah, and I think, if we could educate those kids, and working with Safe Coalition with the kids, like Ben Waters and stuff that have gone on to college as freshmen this year, and I told them all last year, guys, it's a whole different ball game next year. Be careful. And I hope we're not losing kids that way, and I think we are losing kids. Some
But
kids.
that would be a great future program to bring, wouldn't it,
Yeah,
Chip?
it sure would.
Yes.
And the YMCA, the YMCA has been a tremendous stakeholder of ours for some time now, and they put on a transitions program. And part of that program that you were both involved in, Jeff and Ann, I believe, was a drug awareness, so that kids aren't blindsided.
That's right.
I remember my oldest son coming back from his college and saying, "Dad, I saw cocaine for the first time. I couldn't believe how much there was."
My son, I told you, my freshman year in college.
Right.
From the football. It was the first time I ever saw it.
So it's hopefully we'll be able to populate those forums as people get a sensitivity to this.
Good. And shifting back, though, to what now the progress we've made, we've already started talking about it, which is the good part, so that people can see, listen, this is working. Jeff, can you start sort of telling us about, from the legislature level,
Sure.
what's going on and what's happened, so we can kind of see the progress that's being made?
I mean, we can talk in terms of legislatively. One of the first things that we did through our budget last year was to provide $50,000 to get this coalition off the ground. That's a tool that we can rely on. But we did a very significant piece of opioid legislation that was signed into law in March of 2016. And some of the things that I'll highlight from that, the prescription monitoring program. Believe it or not, that when you went to your doctor and you were prescribed a medication, there was no real mandate or protocol for doctors to check to see if you got a similar prescription 3 days ago, 3 weeks ago. There was a program in place, prescription monitoring program, that was very tedious, difficult to use, and simply wasn't working to prevent doctor shopping. So one of the things that we did through the legislation was to mandate that doctors participate in the PMP, but we also backed it up with money, and we provided enough money to totally revamp the PMP program, and that had went online about a month or two ago, and record numbers of doctors are signing up, and they're engaged in actively monitoring how much prescriptions are out there. We very significantly restricted the number of pills that somebody can get when they go to see their doctor. It's no more than a 7-day supply. So having those extra drugs around the house is not going to be an issue. One other piece, if you show up in an emergency room and it's suspected that you are there as a result of an overdose, within 24 hours, that medical facility must come up with a treatment plan for you, a plan to help you recover from this disease. You can't be held there involuntarily, but the facility will work as hard as possible to come up with that plan. So you're not leaving that facility without
It's a huge change.
information and education. And with regard to youth, we do have components in there to require the schools, and I'm sure that the Franklin School Committee is working on their policy now for revamping and having substance use disorder policies. There are some screening programs that are also part of that. But those are the highlights from that legislation. That's not the last piece of opioid legislation or government involvement that we'll see, but it's a great series of steps moving forward. We have a new legislative session beginning in January. I'm sure we'll see some more. And the one other thing I wanted to add in terms of the youth piece, the MIAA handles all the sports throughout the Commonwealth of Massachusetts. Well, they happen to be headquartered here in Franklin. They have stepped up to the plate, and they're taking this on, and several of their employees have attended coalition events and sparked them to create their own collaborative at the MIAA that meets on a quarterly basis, that is coming up with protocols. So, the depth and the level at which these community conversations have reached. I mean, just looking at the folks who are sitting around the room here today, having discussions about programs and things that have gone on throughout the community. It's a very powerful way to deal with the public health crisis of our lifetime.
And I'd just like to add that I'm sure Jeff realizes too, is that they also gave us a great tool in the sense when they redid the protective custody law.
Yes.
And allowing for, before the protective custody law only dealt with alcohol. So if a person was under the influence of alcohol, we could get them help. We could basically put them into custody, bring them to the station, try to find them a bed, things like that. Now we are allowed to also do it if
That's
we
huge,
believe
too.
that somebody is under
Yeah.
the influence of something other than alcohol. So especially if an individual was, happened to overdose, was given Narcan, and basically came out of it, they could technically refuse to go to the hospital. We're not going to the hospital.
right.
I'm not going to the hospital. I'm fine. And the fire personnel, the ambulance, they can't make them go. They can refuse. Now we can say, no, you can't refuse.
Yeah.
We are going to take you to the hospital, and then
That's
we would
huge.
bring them to the
Yeah.
emergency room, and hopefully on the ride over we'd be able to convince them, just get checked out.
A
at the very
lot of
least.
credit on that particular law really goes out to Representative Fernandez from Milford, who's been a key part of this coalition. But he really pushed that with help and with prodding from Dr. Jeff Hopkins, who's at Milford Regional. That was something that they were really pushing, along with all of the police
Mass
folks.
chiefs,
And it's tremendous that these resources are right here in our area that pushed us. And thank you for bringing that in.
And I think we're about to transition into what the coalition is doing now.
No, that's what we're talking about. Yeah.
Right. What our future
Yeah.
plans are. So what I thought might be helpful is just to take a couple of steps back and frame what a coalition is and who we're serving. So the idea of a coalition is that you have stakeholders, critical stakeholders. So what you're seeing here in this room is exactly how a coalition looks. It's just a little larger. So in this case, we have the police, we have the court system, we have town and state government, we have healthcare and concerned citizen, we have an educator with us, and we include clergy, members of the media, many different constituent stakeholders, which really make up our community, the fabric of our community. And so those stakeholders meet on a regular basis to talk, to do just what we're doing here. And the coalition's role as a whole is to provide supportive services to those like Chief Lynch, like Steve Spiewakowski over at the courts, like Jeff Roy or Bob as a government official. We're there to provide a gateway to easy access treatment. We'll talk a lot more in future episodes about the treatment landscape and how difficult it is to navigate. And Jennifer, I know you have direct experience with that. So we'll talk a lot about that. But that's the idea of the coalition. So this is really what you're seeing. We are there to serve communities throughout the Rentham District Court service area, so that would be down as far as Plainville, out to Norfolk and Medfield. There's a Medfield coalition that we'll be collaborating with, and a Walpole coalition that we'll be collaborating with. So we have a lot of aggressive goals and ideas, but I think we've already seen some progress just in the year that we've been together.
Oh, it's unbelievable. And I remember that night at the first meeting and people getting up, and one of the big things they were so unhappy about, there were no beds. Have we seen that expand? Is that getting, there more?
I think so.
Yeah.
I think two things. I think that there have been more beds, and I also think there are more people asking for help. So I'm not quite sure
that's
that
a
there's
good
actually
point.
more beds available.
That's a
So
very
the
good
number
point.
of beds has increased on paper
Got it.
that people can utilize. But I also think that because there are programs like this, there are a lot more hands kind of in the small bucket of trying to get people into those beds. But what I think is fantastic is that there are actually a lot of programs that help people from that detox into rehab and then just after rehab. So people aren't they aren't turning over. We call them kind of bed alumni. They're not going in and then leaving and then maybe going back. And so that is actually the great thing. Before, what we were seeing is that people that were entering into detox might go in 4, 5, 6, 7 times in a few months. And now what we're seeing is 2 or 3 times they're going in. And that really opens up beds for folks who need beds for the first, second, or third time.
Mm-hmm.
Jen, that's a perfect segue. I was going to ask you, we recently went through strategic planning as a coalition together, and we had some very clear initiatives emerge from that. Could you speak to the treatment side of initiatives and how the coalition might assist people?
Yeah, absolutely. So what we want to do with the coalition is really be a gateway for folks to talk with other organizations that can provide a bed. And so what we want to do on the treatment side is create really fabulous relationships with treatment centers that are fabulous for folks, so that when families call us on our support line or come to our resource center or go to the police station or the court system or knock on one of our doors, we can pick up the phone at one place or 10 places and, because we have a relationship with them, get them a bed or get them to an outpatient clinic or a therapist or a mental health provider that they might need in a very timely manner. And so we really want to help people get into that immediate bed and then also work with families on the other side of that to also start their journey of recovery. Because one part of the coalition that we also want to focus on are the families, and that no one is in recovery alone. And while we do want to work in crisis, our long-term plan really is to work in prevention and recovery.
Right.
And so if we can get someone who is really having a tough time with their substance use disorder into some kind of detox and rehab, then that gives us kind of the permission and the space to work with the families, whether that means that the families join a 12-step program, or they go to one of the support groups, or they get in touch with an outpatient clinic of some capacity. At least we have the ability to really work on both ends, both with the families and the person suffering.
Thank you, Jen. Steve, you've had 2 parts. One part was completed before our strategic plan. I'm interested in you talking about the SOAR program just a little bit, and also your plans in the immediate future to assist police departments and first responders with information.
Okay, before I talk about that, I just wanted to mention one of the offshoots
It's
of
called Pivot.
Okay, it's a pivot.
I'm going to do a pivot here, and then I'm going to revert back to the original question. One of the results of the discussions that we're having at a grassroots level in the community has been the increased awareness for the civil commitment for substance abuse, Section 35, as we call it, into the court, and that's where a family member or a blood relative or a spouse can file for civil commitment for a loved one that is having an issue with substance abuse. When I first started in that court, it was more tailored towards severe alcoholics later on in life who couldn't really function and who would become dangerous to themselves or other people. Over the last few years, because of the discussions that we're having, there's been a tremendous shift in just the sheer numbers of people that are coming into the court to file Section 35s for their loved ones. And I believe that some of it stems from the discussions that we're having in the community. One of the things that our clerk's office is doing over at Rentham Court is we're handing people who come in to commit their loved ones a Learn to Cope booklet. So I believe that, because of these discussions, not only have the civil commitments increased, but the Learn to Cope numbers in that support group have increased as well. And so that's both good news and bad news. The bad news is that there are increasing numbers dealing with this issue. The good news is that people are aware of the different types of help that they can get, and they're pursuing some of the different types of help. As far as the SOAR program is concerned, pivot back.
Please do.
The SOAR program was a discussion that we entered into with the Norfolk County Sheriff's Department to ask them if they would provide services to people probationers who were detained, to get them ready to transition them back into the community.
That's great.
So we've had a number of people go through that program. The Sheriff's Department has accommodated us in a number of different ways. One of the ways that they have accommodated us is they are making the Vivitrol shot available to detainees, and that was an option that was previously not available to detainees. It was only available to incarcerated inmates. So those types of discussions with other branches of the government are continuing to open up.
And one of the wonderful things about that is the collaboration with Jeff Roy, who saw Essex and their success there.
Essex.
I believe it was you, Jeff, and then the merging of that information with you as a result of being together, and then having you to go to Michael Bellotti. It's just a great collaborative effort with a lot of success.
Right?
Pretty quickly.
I think that in the short time that we have been involved in this coalition, we have impacted a lot of lives, both very close to us and through sort of the extended tree of information that we have extended out.
And you have some information that first responders are going to be able to...
One of the things that we're working on right now in conjunction with Chief Lynch and the Franklin Police Department is we're putting together a manual for families that are in need of knowing more about how their loved ones are being affected by substance abuse disorder, mainly people who the Chief's Department are responding to overdose calls or medical emergencies where, the best way to describe it, the way I've been describing it, and I hope I'm not insulting anybody by saying this, but we try to create a manual that's sort of navigating the Massachusetts substance abuse system for dummies. And it's sort of what we've created and is going to print is sort of a short manual that's very easy to read that walks you through all the different aspects of recovery from the time that somebody overdoses and the options that are available to them then, and then through the next year or two of what they need to do to continue on the recovery road. So we're going to introduce those manuals at a meeting within the next month. And we're looking forward to the Chief's feedback on what we need to do to improve it, or if they're working out well for families. We hope that we're providing useful information to families that really need it.
And Steve runs is our police liaison and runs a quarterly police chiefs roundtable, or facilitates that. So we have a number of communities that would benefit from this. So I would urge anybody that needs help or wants to learn more about the coalition or would like to become involved, please check us out on the web at www.safecoalitionma.com. We're on Facebook as well, and we're at Twitter at SafeCoalitionMA.
This has been an incredibly powerful coming together today, and hasn't it? I mean, in terms
Yes.
of people giving their time and letting the community know that this is being addressed. We need their help and support, and this coalition is quite extraordinary, and because of the efforts of a community coming together, and we're going to have a lot of powerful shows coming up, right? So,
Looking forward to it.
So again, I want to thank everyone again for this pilot program, and again, many more to follow, and we hope that you'll join us. We want to thank you again. This is the Safe Coalition, Confronting Our Crisis. Thank you for joining us.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.